Hello and welcome to Critical Health News' regular broadcast. My name is John T. McCollier. We are joined by Ben Fuchs, the pharmacist who advocates for the body's natural ability to heal.
All right.
Hey.
How you doing, John T?
Hey Ben, I'm doing all right. It's good to see you.
Good to see you, or good to not see you.
Oh yeah, as the case may be, right. So is that a little tangy tangerine you're drinking there?
A little bit of tangy tangerine and a little green tea.
Ah, okay. Yeah, green tea, powerful antioxidant, am I right?
I am a big fan of green tea. It also supports the hormone system, and that's what I want to talk about today.
Oh, okay. The hormone system.
The hormone, actually, specifically, I thought we'd talk about hormone replacement therapy.
Oh, okay. Okay.
You know what I'm talking about, right?
I know what you're talking about. It's an issue with folks who get older. Women who undergo menopause and things like that.
Yeah. Women go through menopause. Men go through their version of menopause, which is called andropause. And the hormones that we typically associate with hormone replacement therapy, estrogen and testosterone, are youth and fertility hormones. They're growth and repair hormones. So it's understandably distressing that as we get older, it's understandable that we would be distressed when our estrogen and our testosterone drop, and that's why we go to the doctor and get so-called hormone replacement therapy, or today we'll get something called bioidentical hormone replacement therapy, neither of which is a good thing. Standard hormone replacement therapy or so-called bioidentical hormone replacement therapy are not really advisable. That's because the hormone system is extremely potent and extremely tightly regulated. The body uses hormones and then eliminates hormones really quickly. And they're used in the tiniest amounts, nanograms, billionths of a gram. We take even microgram doses, which are small doses of medicine, relatively speaking. We're taking hundreds and thousands of times the amount of hormones that are in the bloodstream. So this represents a real serious problem to the body. Let's talk a little bit about, before we get into hormone replacement therapy, let's talk a little bit about what hormones really are. Hormones are like on switches. They turn cells on. They're different from nutrients in the sense that nutrients support cell activities. Hormones compel cell activities. They make things happen inside a cell. In fact, the word hormone means I arouse to activity. So they're arousal molecules. They turn things on. And this is why the body has to regulate hormones so tightly. So you can't have cells constantly turned on, especially if cells are already sick or already weak. If you use hormones and to turn them on, it's kind of like you have your foot on the gas, but you don't have any oil in your engine. What's going to happen to your engine? You're going to end up burning out your engine.
Right.
And that's what happens to cells when you pound them with hormones exogenously, pharmacologically, that is from the outside. It's like kind of keeping your foot on the gas of machinery of the cells without the cells having the health for them to do their work, end up burning out the cells. This is where toxicity comes from when it comes to hormone replacement therapy. So you've got two major classes of endocrine hormones. That's the hormones that we're talking about here. The endocrine hormones are hormones that start their life off in a gland and then travel through the blood to a site of activity. The most famous hormones are endocrine hormones. And the most famous of the endocrine hormones are the steroid hormones, as opposed to what are called peptide hormones. The steroid hormones are the ones we typically think of when we think about hormones, and they include estrogen, testosterone, progesterone. Those are the main ones. Cortisol is also a steroid hormone. The steroid hormones all have one thing in common, and that is they are all versions of the most maligned molecule in the body, and that is cholesterol. Steroid hormones are all types of cholesterol, versions of cholesterol. Biochemists will say, well, they're made from cholesterol, or cholesterol is a precursor to these hormones, but the structure is so similar that I call them types of cholesterol or versions of cholesterol, which is just one reason why you want to be really careful about using drugs that artificially suppress your cholesterol, especially as you get older, because you're going to you're also going to be suppressing your estrogen, your testosterone, your cortisol, and all of your steroid hormones. So your steroid hormones function, all hormones, but particularly the steroid hormones function as on switches to turn cells on. In the body, they're supposed to be used and then metabolized, used and broken down. When you take them pharmacologically, that doesn't happen. And this is where you run into problems with hormone replacement therapy. And this is why I warn patients to be very, very careful with hormone replacement therapy. In fairness, hormone replacement therapy can mask the symptoms of menopause and mask the symptoms of andropause. For example, if you're having hot flashes, using estrogen, pharmacological estrogen can reduce hot flashes. If your bones are thinning, you can temporarily, only temporarily, strengthen your bones, prevent them from thinning by using estrogen. But you're really playing with fire because the balance of hormones is tightly controlled in the body, and the amounts of hormones in the blood are also tightly controlled by the body. I should tell you now at this point, there's no such thing as bioidentical for this reason. The hormone system is hormones are constantly fluctuating depending on the circumstances, your life, your nutrition, your diet, toxicity in the body. There's all kinds of ways that the body adjusts its hormone mechanism, how much hormones are going to be secreted. And if you're using a so-called bioidentical hormone therapy, you're overriding the body's wisdom in how it secretes hormones. There's no real way you can be bioidentical with exogenous hormones. The only reason they call it bioidentical is to distinguish it from drug hormones, that is prescription pharmacological hormones, which are completely different, totally different chemical structures from the hormones that are naturally produced in the body. Bioidentical hormones use hormones that are identical molecularly speaking, but the problem is the hormone system fluctuates. Your estrogen levels fluctuate, your progesterone levels fluctuate, and if you just pound hormones from the outside, you're not allowing the body to fluctuate or to adjust its hormone concentration depending on its circumstances. So there's really no way you can be bioidentical with any pharmacological intervention. As I say, hormone replacement therapy only masks the symptoms of a weak body. They only mask the symptoms of a stressed out body. So if you're carrying on your daily business the way you ordinarily would, if you're doing things that cause your hormones to drop, that is, you're eating lots of sugar, or you're smoking cigarettes, or you're doing drugs, or you have a stressed out life, you're not getting a lot of sleep, and then you try to correct the problem by using hormone replacement therapy, what you're doing is, as I say, you're putting your foot on the gas when you don't have any oil in the engine, and this can cause problems. You're only masking symptoms, you're not really changing the health of the body. Probably the most problematic aspect, the way I look at it, of hormone replacement therapy is you're overloading the detox mechanisms in the body. The body has to clear out hormones, steroid hormones, quickly because these things are so potent. So the way it works in the body is a hormone will contact a cell and then it will immediately be cleared out. It's supposed to immediately be cleared out, particularly by the liver. So if you're doing things in your life that stress out your liver, now you're adding burden to the liver. And this is where you run into problems with buildups of toxic breakdown products, particularly of estrogen, but also of testosterone. And this is one reason why estrogen and testosterone hormone replacement therapy are associated with cardiovascular disease, diabetes, cancer, all kinds of health issues. Right. In fact, as it turns out, estrogen is particularly problematic. High levels of estrogen are particularly problematic, not so much because of the estrogen, although that might be a problem, but because of the breakdown products, the so-called metabolites of estrogen that can build up. And again, this problem is made worse if you're already dealing with liver problems. So what do you do? If you're low T, for example, if you're a man, or if you're low estrogen, if you're a woman, what do? How can you handle it non-pharmacologically? Luckily, there's a lot of things you could do. For men, body fat is the mortal enemy of testosterone. So if you're low T, that is, you have the symptoms of low T, particularly problems building muscle or sexual problems, libido issues. These are the biggest complaints men have. Low energy. These are the biggest complaints that men have when they're low T. Lose body fat. There's something I've noticed that men get as they get older. I call it the Santa Claus effect. Men lose their edge. They become more fat and jolly as they get older, like Santa Claus. So you want to lose body fat. The best way to do that is to build muscle. Get yourself in the gym. Building muscle is one of the greatest ways to increase testosterone. You can also use something called DHEA, which is a wonderful pre-hormone. It's technically a hormone, but it gets turned into testosterone. It gets turned into other hormones, and DHEA is available pretty readily. Don't take too much DHEA, though. In fact, if you take too much DHEA, you can run into some problems associated with elevated testosterone, too much testosterone, particularly acne, breakouts, and male pattern baldness. You don't want to take too much DHEA. You can also use progesterone, and women can also use progesterone. Progesterone has some pro-testosterone effects in men, and it has pro-estrogen effects in women. Progesterone is a hormone, but it's nowhere near as toxic as estrogen and nowhere near as potent as testosterone. And progesterone is available over the counter, so you don't need to interact with the medical model in order to get your progesterone. I personally like progesterone cream. Some nutritional supplements for both testosterone and estrogen. Zinc is a wonderful hormone, a wonderful mineral that helps with all hormones, particularly estrogen and testosterone. Selenium has estrogen balancing effects. Also, cruciferous vegetables have compounds in them that help the body balance out estrogen and detoxify estrogen. And in fact, there's a couple elements in cruciferous vegetables, one called DIM, or DIM, and another one called I3C, which are so potent for balancing estrogen that they're actually sold as nutritional supplements. If you don't want to use the nutritional supplements, just eat lots of broccoli and cauliflower and Brussels sprouts, especially cabbage, now that I think about it, especially fermented cabbage. Probiotics, good bacteria that is, are wonderful for helping the body balance out estrogen. And if you use fermented cabbage, that is sauerkraut, you'll get the probiotics, you'll get the natural bacteria, and you'll get the DIM and the I3C in the cabbage. So it's a kind of a 1-2 punch for helping the body process estrogen. Eating less food is another great strategy. For one thing, that will reduce the load on the liver, which has to detoxify and process food. Eating less food has a calming effect on the body. Estrogen has a activating effect on the body. A lot of the symptoms of estrogen toxicity involve hyperactivity, that is anxiety and insomnia and jitteriness, emotional instability. So eating less food can help calm the body down. Anything you do to relax the body, including eating less food, including what I call SDR breathing, slow, deep, rhythmic breathing, and also eating less sugar can help calm the body, and this can have wonderful benefits for folks who are dealing with menopausal symptoms. In fact, something as simple as lowering your blood sugar can be a great strategy for reducing menopausal symptoms, particularly the jitteriness and the anxiety and the lack of libido or the decreased libido. Relaxing the adrenal glands. You know, the adrenal glands make female hormones and male hormones, and they're especially making female and male hormones when the ovaries and the gonads, when the production, gonadal and ovarian production of these hormones drop. So as we get older, we don't make as much testosterone in the gonads. We don't make as much estrogen in the gonads. And what's supposed to happen is the adrenal glands are supposed to pick up the slack. But if our adrenal glands are stressed out because we're eating too much sugar or because we've got a stressed out lifestyle, then the adrenal glands are going to get burnt out. If the adrenal glands when the adrenal glands get burnt out, and also if we're dealing with a stressed out lifestyle, the cholesterol that should be making estrogen and testosterone are going to be redirected to cortisol. So when the adrenal glands are overworking, we're more likely to suffer from the symptoms of menopause, the well-known symptoms of menopause, as well as low T. So calming the body down, doing things to relax the adrenal glands, and also using nutrients for the adrenal glands. There's lots of wonderful adrenal nutrients. Vitamin B5 and B12 are very important for the adrenal glands. Vitamin C is very important for the adrenal glands. And also zinc, as we talked about earlier, is very important for the adrenal glands. One of my favorite ways to calm the body down if you're dealing with menopausal symptoms for women is to use magnesium. Magnesium is very important for the body to make hormones, but also has a calming effect on the body. GABA is another calming nutrient, GABA, that's readily available. Also something called theanine, THEANINE, which is found in green tea, is also a great calming nutrient. Green tea, as I was saying earlier, is just a great all-around health beverage. Plus, it gives you a nice little buzz. The caffeine will give you a nice little buzz. And it also, interestingly, because of the theanine, has a calming effect as well. So drinking green tea can help. And then just getting on a good all-around nutritional supplement program. The Healthy Start Pack, Beyond Tangy Tangerine. I forgot about essential fatty acids. Very, very, very important for estrogen. In fact, not only do essential fatty acids help stimulate estrogen production, but essential fatty acids, particularly omega-3 essential fatty acids, have an estrogen-like effect. So using your ultimate EFAs and even maybe making sure you're eating lots of good fish, fatty fish, particularly halibut and salmon, fish that have good fats, good omega fats, can also help. And that fish also is a good source of selenium, which is also important for balancing out estrogen. So making sure you're eating lots of good fatty fish can be a very, very helpful pro-estrogen and anti-menopausal symptom health strategy.
Ben, you were talking about adrenal health, and I was curious what the role of caffeine would be in terms of adrenal fatigue or anything like
jacks
that.
up the adrenal glands. Caffeine is like cortisol. It's a stress hormone. So it jacks everything up. It stimulates the adrenal glands. It stimulates the body. That's why we do caffeine. So if you're a caffeine drinker and you're not doing some of these nutritional strategies that we just talked about, the chances are good that you're gonna have a lousy menopause if you're a caffeine drinker. So reducing the amount of caffeine or using green tea to get your caffeine, because the theanine in the caffeine, the theanine in the green tea can help counteract or can help balance out some of the effects of the caffeine. So get your caffeine buzz from green tea.
Interesting. Ben, you always hear about testosterone as being the male hormone and estrogen as being the female hormone, but my understanding is that we all have some kind of intricate balance between.
Yes. That's a little simplistic. Women make more estrogen, men make more testosterone, but yes, you're absolutely correct. Women need testosterone, men need estrogen. Estrogen plays multiple roles in the body. Estrogen is important for brain health for both men and for women. Testosterone is important for muscle building for both men and for women. Testosterone has some cardio, heart protective benefits for both men and women. So it's important to recognize that we're all testosterone, whether we're male or female, we're all testosterone producers and estrogen producers. It has nothing to do with gender, although women make more estrogen, and estrogen is responsible for female sex characteristics. Men make more testosterone, and testosterone is associated with male sexual characteristics. But your point is well taken. We both, as men and women, use both hormones and manufacture and use both hormones.
There's a kind of a you mentioned the Santa Claus effect. There's that situation where men, when they get older, they start to essentially grow breasts. It's an overweight thing.
Effect. It's a sign of estrogen. You need to do estrogen detox. One of the best ways I said earlier, losing body fat is a great way to lower estrogen for men, but also using things that help the body clear out estrogens. Aforementioned probiotics help the body clear out estrogen. Also, bentonite clay is a great way to help the body clear out estrogen. Fiber is another great way to clear out estrogen. Fiber has a couple of benefits for helping the body clear out estrogen. Number one, it'll help you have better bowel movements, and estrogen is lost in the bowels, is lost in the stool. So eating more fiber can help you have better bowel movements, help you eliminate estrogen more effectively. And fiber also feeds the probiotics. It feeds the good bacteria, and the good bacteria are also involved in helping the body clear out estrogen. So eating more fiber, using vegetable juices that contain fiber, especially cruciferous vegetable juices, things like cabbage juice, for example, can have some really powerful multifactorial effects for helping the body clear out estrogen. The DIM and the I3C can help detoxify estrogen. The fiber can help you clear out excess estrogen, and the phytonutrients, the flavonoids that are found in vegetables, particularly things called polyphenols, which are found in all vegetables and fruits for that matter, can have an estrogen balancing effect. So what we're saying here is just living a healthy lifestyle.
Right.
Reducing your sugar, eating vegetables and vegetable juices, using nutritional supplements, using probiotics. We didn't talk about exercise, but that's also very important for helping move the blood and move the lymphatic system. Estrogen clearance partially depends on the blood as well as the lymph. And when you exercise and move your body, you're improving lymphatic circulation and also blood circulation, both of which can have a benefit for helping the body clear out estrogen. So also exercise is important. So it's all of these things that we talk about all the time. It's not like there's something special necessarily that you need to do to improve hormonal health. It's just living a good, clean lifestyle, making sure you're supplementing, making sure you're exercising, making sure you're doing your slow, deep breathing and calming the body down. It's the same stuff we all have to do no matter what our health challenge is. And this idea of depending on hormone replacement therapy is a classic example of medicalizing or medicalizing ourselves instead of changing our lives. And while it may have some symptomatic benefits, you may be able to reduce some of the symptoms, in the long run, it's going to cost you your health and maybe even cost you your longevity.
Yeah, I'm also curious about what role psychology and social engagement play. I imagine somebody sitting at home watching a game show all day, and of course their hormones are going to fall off. But if they're out at a music festival or something, dancing with a whole bunch of young people, the activity and the engagement and all that's going to drum up a hormonal reaction.
That's right. You can think sexy thoughts and raise your estrogen. You can think youthful thoughts and raise your testosterone. There's a The mind-body link used to be considered airy-fairy and kind of not evidence-based, but today nobody doubts the link between the mind and the body. How we think has an effect, if not a major effect, at least has an effect on how the body shows up, particularly hormones. Hormones are actually the link in many ways between our thoughts and our physicality. As we think, every thought we think creates some kind of hormonal change in the body, for better or worse. So yes, you can have a tremendously beneficial or a harmful effect on the hormone system, on the body in general, by how you're thinking. And don't underestimate the power of your thoughts. People have understood the power of thinking since biblical times, probably even before biblical times, pre-biblical times. But today we understand that as you think, you change your body, and the link between thoughts and body are what we call hormones.
Amazing. Well, I've been extremely educational. I think I'm going to go tell my wife that she's beautiful and give her a big kiss.
Yeah.
And
raise hormones, raise her estrogen.
Exactly.
Think sexy thoughts.
Yeah, I'll have to explain to her it's for your health.
Exactly.
Oh, great, Ben. Thanks a ton, hey? I appreciate your time.
Good to see you.
Thank you all for joining us. This has been a Critical Health News broadcast. Please take a moment to subscribe to our YouTube channel, follow us on Facebook, visit criticalhealthnews.com for more alternative empowering articles and videos, and sign up for the newsletter.